safety for a collaborative with 5 CCGs who cover inner North West London. But the project that I'm going to talk to you about is the work that we did to produce the heart system, which was when I was head of primary care nursing for North Central London, so a previous role when we were working for PCT. So part of my role was to look at the primary care strategy and to look at where the gaps were in nursing practice. And it's becoming increasingly recognised that where nurses are happy and well supported, the patients are happier and the experiences of the patients and the outcomes of the patients are better. So that was one of our key work streams, was to look at creating better supported nurses, and especially for primary care, they're a very isolated and quite a unique workforce for a number of reasons. So the out-of-hospital strategy to which I was working is quite similar, I imagine, to lots of strategies that you're working to, and is replicated with a number of different headings and names in the NHS, but essentially it's about getting care out of hospital and into primary care, into the community. It's about getting better care for patients closer to where they live. It's about enhancing the integration of services, keeping people healthier for longer, preventing ill health, ensuring a coordinated approach, and to shift care essentially from the acute services, like I say, into primary care and into the community. So for nurses that have traditionally worked in the GP practice, that's going to mean upskilling them and introducing them to a number of different things that they currently may not practice. So the overview of the presentation and the ambitions of what the project we were trying to achieve was that we were, first of all, going to do a review of that workforce, have a look at where the gaps were between what those nurses were doing now to what we needed them to do in order to deliver the strategy. We're going to have a look at some of the challenges for both the nurses in practice, but also for the commissioners trying to manage and monitor quality from a commissioning perspective. We knew that we certainly wanted to have a better, a more coordinated approach to training and development for the nurses. And we wanted to consider the links between appraisal and CPD and whether or not there was any, or if it was just an appraisal is a thing that happens annually and then nurses pick and choose courses as and when they kind of see them and are interested in attending them. And we also wanted to have a look at how commissioners might do a more appropriate workforce planning in the future and quality measuring. So we had a number of drivers behind this and reasons why we decided that this would be a really important work stream for us. And like I say, it's really well recognised the importance of staff satisfaction and the importance of investing in the development of your workforce. And we wanted to, there's a quote there from the Berwick report at the bottom which we thought encapsulated what it was that we wanted to do. So another national driver which was quite timely when we were creating this piece of work was the NHS England, or Commissioning Board as it was, National Nursing Strategy, which from feedback from our nurses we felt that they felt quite detached from at the time. They didn't feel necessarily that this overarching strategy for nursing care for England necessarily was meaningful and were part of their everyday life. So what we wanted to do was make sure that that was incorporated. But the key thing for me from this document was, and I'm sure that you're all very familiar with the 6 Cs and the different action areas, was the importance that this document put on supporting staff and making sure that staff had appraisal and making sure that it wasn't just a tick box exercise, but that it was a really meaningful appraisal and that it was value-based. Another national driver, and something else which I was able to use to support the work that I was doing to drive the work forward, was the revalidation from the NMC, which, as you all know, comes into play in 2015. Now, although it's still under consultation, we appreciate that things aren't hard and fast yet, we know that it's about enhancing public assurances. We know that it's going to require the nurse to take a more proactive approach to training, development, appraisal and maintaining their portfolio. Another interesting thing for me was that it also requires confirmation of competency from the managers. And so that was something that we wanted to consider. The 360-degree feedback, which we felt would be quite new to some areas of practice, and reviewing of the ongoing CPD. So our starting line, how did we get to the end product? We started by undertaking a scoping, a survey and a workforce analysis of the staff that we currently had in North Central London. And we came up with lots of challenges for that particular workforce. They are a very unique workforce. Some feel quite isolated and unsupported. They're not like part of nurses that form part of a team on a ward. Some are working on their own in a single-handed GP practice. They're not employed by the NHS, they're employed by the GPs, which adds complexities in terms of being able to influence and tell them what you think they should or need to be doing. There's really big variation between contracts and pay. Because of the fact that the GPs are essentially running a business, there are often, for nurses working in smaller practices, lots of emphasis put on them needing to do training within their own time. There isn't that same culture of being released to attend training like there is in big organisations, in my experience. Succession planning is something else that we wanted to consider, and we're talking about creating a future pathway for nurses and to try and build up that infrastructure within primary care to show that you can have a career in primary care and it is a good place to choose to work. And so part of that was about how do we help start to build that infrastructure and encouraging newly qualified nurses to come into primary care. Also, we found that there were not much supervision or mentorship programs or support for the nurses. So from that huge, great list of challenges, we managed to sort of put each of those into 4 headings, which is what we used to drive the project forward. So our 4 key concerns were the NMC revalidation and collecting of portfolios, the ability to, as commissioners, to get assurance and monitor what was happening within primary care nursing. We know that access to training is a problem for nurses, and we know that quality of appraisal is sometimes a problem as well. So our ambition was to be able to create one system that would help us improve all 4 of those challenges. So as Simon alluded to, I worked with him and the team to talk about what it was that we needed and what we wanted, and as a result of that, we have created the HEART system. And this is what it looks like. So I'll talk you through it in a little more detail, but essentially this is your front page that you get as a nurse. You would log on and this would be your front screen. So across the top, you've got these tabs which take you into a different part of the system. And as you can see, you've got your evidence, your appraisals, your portfolio, and your training and your PDP plan. So I'm just going to look at those challenges and then see whether or not the system actually does do what we wanted it to do. So first of all, we've got access to training. So we know that availability to training is a problem, and so we felt one way of reducing that problem would be to increase the number of online tools that are available for nurses to get updates and refreshers. Now I know that there's a whole host of online training available, but often nurses don't know where to go to get it. They don't know which ones are accredited, they don't know which ones would be their employer's preferred choice. And so we thought we would put all of that in one place for the nurses. Now, like I say, this is a really new system that we are growing and developing. So I've put at the bottom there some of the longer term ambitions of the system. So we don't feel like we've got a completed project here. We are ambitious about where we think it can go. And some of the approaches that we would like to explore further and have already discussed with some of the universities and things are a blended approach to learning, having a university course where they may have some of their training done online and then not having to be out of the office or out of the practice for quite so much time. And there are a number of other things there. So how does this work on the system? So you would click on the My Training tab. You would have a look at the menu of options available to you, and that list or that menu of options could be identified as what you needed to do in order to get your within a GP practice to make sure that you could go through your CQC registration. If you were looking at it from a larger provider, you might decide that you would have some mandatory training on there, like infection control or information governance or something like that that can just be added onto that menu so that for your provider or for your organisation, the nurses know which ones you want them to do. You click on your Launch Training tab and it takes you straight through to an online training module which you then complete and fill in an assessment having done that. So we'll come back to training in a moment, but that's how you access your training module. So the quality of appraisals, that was our other big problem for nurses. And one of the biggest challenges, or one of the biggest things that we wanted to achieve was getting greater support for practices to undertake their appraisal and to support their development as well. From some of the workforce analysis that we did, we found that it wasn't always a nurse appraising a nurse, sometimes it was the practice manager, and so we wanted to guide that appraisal to be quite nursey focused for our nurses. So we wanted to provide a mechanism for nurses to really take the lead in coordinating that appraisal, and as Alison said, for them to be able to dip in and out of it throughout the year, for it not to be just a once a year task. We wanted to also provide managers with a template to work to, which allowed much clearer connection between appraisal and the development needs of the nurse. And we also, like I say, wanted to bring that national nursing strategy that nurses didn't always feel was part of their everyday being into their everyday practice. So in order to do that, you click on your appraisal tab at the top, and under the input form, you then access your appraisal form. Now I haven't added an appraisal form there because that can be stipulated by your organisation or by your practice. So moving on to our next challenge, that's our NMC, revalidation, and the trouble that we nurses have maintaining and updating a portfolio. Some of the challenges that we know exist out there is that people say, yes, I've got a portfolio, but actually what they mean is they've got a drawer full of certificates somewhere. And so what was really key for us was the ability to scan and upload that drawer full of certificates so that we didn't lose them. We wanted to be able to have space to capture reflection about any training or development that we've done. We also wanted to get a little bit more organised with the training and development and for it to be a little less ad hoc. And we wanted for those online training modules that I previously showed you to automatically be reflected within your portfolio to show that you've completed them. So essentially what we were looking to create was this sort of always ready portfolio, which is electronically saved. So how do we do that? We click on our evidence folder. If we've just attended a course and we've got our precious certificate that we are going to put in the drawer any minute, we would scan it first of all, and it would be then saved within your within this particular submission sheet. But in addition to just having that certificate saved, what this allows you to do is link it to the 6 Cs. So if you feel it's something that has increased your specific competencies in something, you click "this has increased my competencies" and you save it under competencies. If it was a course that you felt was really related to compassion, you could put it under the, you could pick which one of the 6 Cs that you're going to save it under. It also, every time you upload a piece of evidence, asks you for some reflection on it as well. So that it, like I say, isn't just a certificate that's meaningless. You actually are prompted to reflect on how you're going to use that skill or knowledge that you've learned and put it into practice. Once you've clicked submit, you can then go to your portfolio and you can see your portfolio grow. And the good thing about linking it to each of the 6 Cs is, if you are reviewing your portfolio throughout the course of time, by linking it to the 6 Cs, it helps you identify where your gaps might be or where you might want to focus some of your additional training. If you saw that you had everything saved under one of those 6 Cs, you might want to explore some different types of training. Often it's you know, we like certain things and so we're drawn to those, but that isn't necessarily where, as a practitioner, you need to increase your skills. So it helps identify gaps. So, assuming we have uploaded our evidence, we've completed our appraisal documentation, you then get a string of greens which show go, you're passed, you're through, and you have completed your appraisal process for that year. So then if we just think about our last challenge, which is from a commissioning point of view, how do we monitor the quality of care that's being provided in primary care? How do we best support nurses? How do we know what training they're missing? How do we know what training they've done? How do we know that they're safe and competent? And the solution that we felt would be to have access that gave us overview of activity within an organisation. So as a practice manager, you could use that dashboard function to have a look at how many of your 15 members of staff have done an appraisal. You could use that dashboard to say how many of your staff have done their mandatory training. If you've told everyone they need to have done their infection control training, you can use this dashboard function to see how many of them have been into that My Training tab and completed and passed their infection control training. So it also captures for us as commissioners another thing which we find very tricky is how to communicate to nurses and maintaining a database of nurses that are coming and going within the 300 practices that we serve. So by having an individual page per nurse who has put their email address into the system, you have a direct database of all of those nurses that you want to communicate to. So if you get some funding and you want to put on some training at short notice, you have a really easy way to communicate with that cohort of staff. It also allows you then to create networks and forums, because in that front page, nurses can say where their specialist areas might be. So you can use your dashboard function and the functions within the administrative section of the database to identify these 13 nurses are all really interested in COPD. They've all done an advanced course in it. I can see that. So you can contact just those nurses to say, would you like to be involved in this project, or would you like to create a network or a forum, trying to enhance that kind of community feel within a cohort of workers who are geographically spread all over the place. So where are we now? So For those of you that are within the NHS, I'm sure you'll be aware that there has been an enormous amount of change happening. And as of the 1st of April last year, the PCT split into CCGs, clinical commissioning groups. So I have since moved on from my previous role, but where we set the project up was for North Central London, and 2 out of the 5 boroughs who were part of the original project are now up and running, and the nurses are using the system. So just in conclusion, I think to go back to where we started from, which is where nurses feel more supported and where nurses feel that their training and their development is more structured and more streamlined, the outcomes for the patients are better.